Hi, I'm Danielle Varda, and I'm presenting today on behalf of the Visible Network Labs team. On our team is Amanda Beacom and Kaylee Baczynski, and we are presenting today on the section that is understanding the ecosystem to address loneliness in 6 cities. So part of this project is to learn about networks on the RECETAS projects that we can use to inform the design of interventions that will leverage existing strengths and gaps in network connections. And using a network analysis approach, the project plans to visualize these existing networks and create place-based understanding of how nature-based social prescribing can be promoted and sustained locally. So our team is made up of a group of data scientists and technologists from a company called Visible Network Labs, and our mission is to make invisible networks visible. We are a social enterprise that is committed to helping people, organizations, and communities use network science to increase their capacity and make a positive difference in the world. We do that in a couple of ways. We provide technology specifically through a data platform called Partner, which we'll talk a little bit more about today. We also provide training and data analytics. Our hope is to empower people and communities to build better strategies so they can improve the outcome of their work. So on this project, a little bit of background. We were part of Work Package 2. You've heard a little bit about the RECETAS project and the purpose of it. Our specific goal of this section is to use the partner platform and the data within which we collected to better understand how stakeholders across these 6 cities are working to address mental health, well-being, and loneliness through social prescribing and nature-based activities. So the types of questions that we are trying to answer are things like who is working on each of these issues in the different cities? What activities do they engage in? Who do they serve, and how do they discuss these issues? What language, what words are they using? What are the outcomes of the connections and the characteristics of their relationships? And we were also interested in special topics like how COVID-19 might have impacted some of this work and their focus. All right, so our methods that we used, we conducted this work between October and November of 2021. I mentioned we used a social network analysis, which is a method that looks at who is connected to whom, how those connections vary and change. And we're often looking for patterns in those connections to understand things like outcomes or perceptions of systems. We did use the partner platform to do this work, which is a platform that provides a survey and analytic tool to collect these types of data. In this particular study, we had participation from 253 organizations across 5 cities. And we also had an additional data collection in a 6th city where we used a little bit of a different approach because of some concerns around privacy and how the data are collected. But of these 253 organizations that we invited to participate, 160 responded, and there was an average response rate of 63% across the different projects. So let's talk a little bit about what we found. We're going to start with composition and structure of these stakeholder networks. And our goal here really is to try to better understand the landscape of who is doing work related to this area and how they work together. And when we started this work, we weren't really sure what those lists of members in those stakeholder groups really looked like. And so it took some work, and we needed to do some really thoughtful and intentional collection of organizations and create some boundaries and definitions of who might be included in this kind of work across these different cities. So very early kind of exploratory work around this topic. So what you'll see here is a little bit of detail about each of the 6 cities. And you'll just see the 6 cities included Helsinki, Cuenca, Melbourne, and here you'll see a little bit of information about when the data collection effort was launched, the response rates across those cities, the number of folks that were invited, and how many responded. In addition to these 6 cities, We also included Barcelona, Prague, and Marseille. So again, you'll see that here, and you'll see that Marseille was the city where we did it a little bit different in terms of, rather than giving everyone in the city a list of others to respond to and tell us about their partnerships, rather we asked them to list their partners and give us the names of them. So it was a great experience actually to have some differences in that, so we could see how the outcomes were impacted by those different ways of collecting the data. So let's look at some of the results. So when we do this kind of data collection, we start to see network maps, and the mapping is a really great exercise. It gives us a visual on these partnerships in a way that can increase some understanding. When we do a network analysis, we list all of the partners, and then we ask them questions about each other. Things like, what kind of relationship do you have with these partners? What is the outcome of that relationship? You know, what's the intensity and maybe quality of those relationships. So when we do that, we get mapping as an outcome. I always say the network maps are like the front cover of the story of our networks, and then we can open that book and we see all the information about those relationships. So this is only the first step into the story of these networks. But what you'll see here, from a very kind of high level, are some different structures. So you'll see Helsinki has a very kind of decentralized structure with a core periphery kind of pattern, which means we do see more connections in the center, and then some of these organizations on the outside with fewer. Cuenca has what we call very centralized network structure, where there is one organization that seems to be kind of at the center of things. So you can imagine if we remove number 15, we've coded these by numbers to protect some anonymity here. But if we pulled out 15, you can imagine how that structure would change. So that could be a consequence of how we collected the data or how someone answered the surveys, but it also gets us thinking a lot about what happens to these networks when an organization comes or leaves a network. And on Melbourne's structure there, you can see there's kind of two components. So you'll see on one side, there's a group of organizations, and over here, another kind of tied together through some of these that are really bridging organizations. So just by a picture, we can start to see some differences and patterns in the ways that different folks interact. And then one more slide here, Barcelona and Marseille, you can see, had a lot of organizations. So just the size of the sample of the study changed very much across the cities. And this is really interesting because we didn't know what to expect. We really didn't know how each of these cities would respond to the question of who's working on this particular topic. And so this gave us some insight into that. And because these networks are so large, it is somewhat difficult to see patterns within them. That's why with this kind of network, this kind of data, we can pull the network apart and we can look at subgroups and different patterns and things like that. But right here, we're just showing you kind of the large view of all the members and all the relationships between them. So let's look at one more finding from what we call the relational data. So the data that comes from having answers about how people respond to each other. So in this question, people were asked, has this relationship resulted in any of the following outcomes? And that means that each organization, when they answered a question about another organization, they answered what was the outcome of that relationship. So that's at the dyadic level. And it means that we're answering questions about the outcomes of actual relationships. And then we aggregated that up here. And so you'll see that most people reported that their relationships led to an exchange of resources. And you can see by the colors how that varied across different cities. But overwhelmingly, that was a pretty common answer, that that's an outcome of these relationships, followed by led to increase in public awareness and understanding of the issue. So you can read through the slide and see all of the difference there. Some of the things we see on the other end there was, I think led the two at the bottom that were not none or haven't had any, is led to improve citywide outcomes and led to reduction in citywide health disparities. So some commonality there across all of the different cities on what folks felt were the most common results of these relationships. So what this gives us is a baseline at this point for understanding where we can build interventions and where we might want to focus and grow. All right, so following that, we have a couple other outcomes based on some other areas of the survey. So in this section, we were really looking at, who was involved in these networks and what can we learn about them. So what we learned in network composition and by sector and industry is that most of the organizations that were either picked or included in these networks came from the environment, ecology, or sustainability sectors, followed by social services, healthcare, public health, and education. What we see far fewer were sectors like technology and economic development and landscape design. And that's okay. What this shows us are places that if we are in sectors, that if we are interested in growing this work in a cross-sector kind of diverse way, those are areas where we might want to recruit network members from so that we can build interventions that include things like urban planning and landscape design and philanthropy. So this really shows us where we have more of a consensus and a group of organizations within a certain industry, and where we might want to focus some work on building new relationships. All right, so we also asked about nature-based solutions and how these stakeholders were able to implement those solutions that involved green space, outdoor recreation, nature walks and cycling, and community gardens, among others. So the question asked here was, which of the following solutions in nature, natural spaces, or activities in natural spaces does your organization use to address mental health, well-being, and loneliness, if any? So we found that most of the organizations said that green spaces and outdoor recreation, nature walks or cycling, and community gardens were some of the top ways that they were using these kinds of solutions to address mental health, well-being, and loneliness. And then we just see some others at the bottom there where they are less commonly used. But again, great places to see where we might want to focus some of our resources, or as we're testing out some of our assumptions, we can test whether the things that people are using now are working well, and whether we need to bring some new and different, maybe innovations into the work in some of these other solutions. All right, so we also asked people about their familiarity with some of the terms of words that we're using. So in this case, we asked people, to what extent are you aware of the term nature-based social prescribing? What we learned, what you'll see across the top, is an average of the categories of what people said. So across all sites, you can see that there's a lot of variance around the different answers, meaning that there's commonality in each group in terms of the numbers, but it's pretty split that of those that said they're very aware versus somewhat aware, slightly aware, not aware at all. And then as you look below, you'll see how that varied by the different cities. And that it's quite different, actually. You'll see in Helsinki that most people said they are somewhat aware, where in Cuenca, where we see that 44% of the respondents said they're very aware. However, 56% they said they were only slightly aware or not aware at all. So we see a lot of variance across the different cities in terms of the way people use these terms and are understanding them. So one way we can think about these data are, to what degree can we develop common language and common nomenclature around these topics, and which is usually a great way that we can increase effectiveness of interventions. All right, and so we also asked, to what extent have nature-based solutions to address mental health, well-being, or loneliness been adopted by people in your city? So here again, we see at the top all of the different sites. And then some differences down here where we see some cities where they said it's been adopted a great deal by people in our cities, but some down below, like Marseille, where 80% were only a small amount. So again, some differences across different cities and types of cities that have embraced a little bit more of this type of work. So again, a great baseline of where we are at the start of this project in terms of the ways that people are thinking about this work more generally. Okay, so just a few more results that we're going to share with you. In terms of community impact, We asked people their perception of some success. So for example, we asked, how successfully does your city achieve the following objectives with regard to addressing mental health, well-being, and loneliness? And what you can see here is that so you'll see the scale at the bottom. So the darker greens and blues show the very successful or somewhat successful responses. The yellow is neither successful or unsuccessful. And then you'll see some of the responses somewhat unsuccessful or very unsuccessful. So what we noticed, the pattern that we noticed here was that at the top, what we see more people agreeing have been more successful are some of those processes and systems work, like increasing green space and green infrastructure and increasing public awareness, or maybe committing to change at the systems or policy level. So these policy work, more of the big processes that have occurred in cities are some of the more successful pieces of work that folks have been working on. But you'll see at the bottom, some of the focus on the more individual service delivery work at the individual level around delivering mental health services, receiving social prescribing, either for individuals or hard to reach or special populations, has been you'll see some consensus here that that's been less successful. So pretty interesting in terms of some differences of consensus around some of these system level system level programs, and then more of the individual level programs down here where we're not seeing as much success yet. So just a great opportunity to see where RECETAS can come in and make some big difference in that area and increase success in delivering direct services to people in these areas. All right, so then we asked folks about the impact of COVID-19 on their work. And what we saw was, we asked the question, how has the COVID-19 pandemic affected your community's progress in addressing mental health, well-being, and loneliness? And what we see here is that most respondents believe that the COVID-19 pandemic increased public awareness of the problem of mental health, well-being, and loneliness. But respondents were more split on, for example, the question of funding to address the problem. So while 41% said they were not unsure, there's kind of this split around those saying it increased, there was no change, or it decreased. So that's an area that seemed to have less clarity for people on how the pandemic impacted this work. And then we also saw that the number of people receiving services and treatment for the problem, there was also almost half of folks here said that COVID-19 did not impact that. So while public awareness has increased and collaboration among organizations has also been perceived as being something on the increase, we haven't seen, again, as much direct services being delivered to folks, and that the impact of COVID might not have changed that. So again, great insight into what's going on and how we might be able to increase some work in that area and focus on the direct services of these kinds of interventions, these kinds of social prescribing for people at the direct service individual level, and the connection between what we're doing here with looking at the system and how that system can help to fill the gaps of direct services to people is really the reason that these data will be so valuable for all of the work going forward on RECETAS, enable us to refer back and hopefully see those big changes over time, both at the systems level and individual level. So we are not there, and we are very sorry not to be with you all today. We appreciate the opportunity to be able to come to the conference in this way. We can't answer questions live, but if you do have questions, this is Kaylee's email address, and please email her directly any questions about the project or our team's work, and we'd be happy to connect back with you on that. And we always encourage everyone to stay connected with us at Visible Network Labs. We love connecting with folks around these topics and have really been privileged to be a part of the RECETAS team, and look forward to the work that we'll be doing with them in the future. So thank you again for having us on this conference today with this presentation, and we look forward to any questions you might send our way.